Welcome, everybody, to the 33rd episode of Ask Dr. Smith Live. We have some really great information to share with you this week, and we have some very interesting questions. There was basically one asking about Parkinson's. Someone was diagnosed as a beginning stage of Parkinson's. Any type of neurological problems, you have to define what's in the brain causing the problem, whether it be pesticides, herbicides, insecticides, heavy metals, viruses, vaccines. And you have to find a practitioner that does what they call direct resonance testing or quantum testing, where they literally can determine what's in the brain causing the problem. It's if you read my book, Remove the Splinters and Watch the Body Heal, there was a case in there of Parkinsonian issues, and in 3 months' time, we had tremendous changes in the functionality of this person. So you also, if you have parasites, I have this whole program. We spoke about detoxing on, I think, last issue or a couple issues back. It's on ghsdoc.live. We also have an online course on detox that walks you through the whole program. It's really intense. The bottom line is it's like building a house. You don't build a house and then decide to address the foundation. The foundation is your gut. 60 to 80% of your immune system is your intestines. So you really have to clean house. You have food-grade diatomaceous earth. You have ivermectin. These are great parasite cleanses, wormwood. But I don't, be honest with you, the two-dimension, the ivermectin or agramectin, they're both the same product. They're very inexpensive. They're about $30 for a 50 ml bottle. You can buy it online from one of these either veterinary sources or stores that supply animal foods and things. You don't need a prescription for it. And for $10, you can get, I think, 2 pounds of food grade diatomaceous earth. So the key is it'll take 90 days using a tablespoon of diatomaceous earth and 12 ounces of water first thing in the morning. So on the 76th day, you can take the ivermectin, which is 1 cc per 100 pounds. So if you're 160 pounds, it's a tiny bit over 1.5 cc's. And then on the 90th day, you take the second dose. You do it orally, so you don't have to inject it. And that helps clean up any mess that's left. Then you need good probiotics to reimplant the healthy bacteria. Prescriptive Cyst is a phenomenal product. It has 29 soil-based organisms. Then we also have Bravo you can buy online. It's another great, it's a yogurt. You make it yourself. It's very easy. Take like 5 or 6 tablespoons first thing in the morning. And also the one from Budapest, Cocoon Drops. Start off with like 15 drops first thing in the morning, and then before bedtime. After a week, you can reduce it to 10 drops AM and PM. So once you get that all straightened out, then you have to start looking at parasites, which the intestinal cleanse will take care of you. Glyphosate is a major toxin in our environment because it's in the rainwater now, so everybody's getting it. And then you basically have to assess the different organs, especially the liver. You got to clean that out first because that purifies the blood, which your entire body's blood goes through the liver every 3 minutes. So if you don't feed the liver the right nutrients to process the toxins that it's pulling out, the poison just keep recirculating. So it's ridiculous. You're not really going to, get anywhere just trying to detox the body and not clean the liver. And then open up the avenues of excretion, go after the heavy metals, take the ionic minerals, because your body won't let go of the heavy metals if you're deficient in trace minerals. You go after the glyphosate, then you go after any infections, and then again, you're looking up into the brain, and you can detox with clay packs on the brain, virtual injection, which is very simple. And then also You can, use the different nutrients. So, for example, if you find cytomegalovirus in your brain, cat's claw works really well. So again, you have to define what the underlying issue is. If you don't define it, you're just throwing darts. So I think that satisfactorily answers that one. We had another one about vitamin D3, whether you can put it on the salad. Yeah, you can put it on the salad. It's just as easy to drop it on the tongue. 10 drops first thing in the morning directly on the tongue. It gets absorbed into the body very quickly. If you start putting it into the salad, it may combine with other salad dressings and stuff like that and not get absorbed, 100%. So, and make sure that your salad dressing is not using the adulterated oils that you're buying in the supermarket. You really need super, super clean. The best I've found is Dr. Brian S. Peskin's formula. We use its clinician's preference 11-to-1 ratio of omega-6 to omega-3. I put it on my cat's food. I give them 9 drops periodically. So you have to use really high quality oils on your salads, so your body benefits from it. So that's that question. What would you recommend? Poison ivy. That's a walk in the park. A homeopathic remedy called Detox. You just put the little pellets under your tongue, and like cures like. So if you have poison ivy and you take a homeopathic form of poison ivy, which is the homeopathic remedy, Detox, it'll neutralize the itching and all the swelling, and it's just so simple. There's also natural anti-inflammatories, quercetin, CoQ10, resveratrol, glutathione, and you got to keep that liver clean. You should detox the liver twice a year. It's that simple, people. You change your oil and filter every 3,000 to 5,000 miles. Why do you treat your body any less than your automobile? So if you keep that going, you'll be a happy camper. See, Jared, thank you for doing this. I could explain how the method of putting the piece of paper with the dog's name in his pocket. Okay, it's basically called quantum entanglement. Everything's connected in the universe energetically, okay? So when you write your pet's name or your child's name on a piece of paper and you put that into your pocket, you're literally putting the frequency of that person's name into your energetic field, your aura. And the body picks it up and communicates it. I'm telling you, it works. I mean, I recently, one of my patients, they adopted a stray cat. Cat developed urinary problems. They spent $3,000 getting a sex change on the cat because they rerouted the ureter. That was kind of lunacy, but whatever. And about a couple months afterwards, the cat developed the same damn infection. So my patient was telling me about the problem. I said, well, write the cat's name on a piece of paper. First, I tested the patient. Nothing showed up dramatically. She put the cat's name on a piece of paper, put it in her pocket. I retested her. I said, your cat has parasites. I gave her some ivermectin. They gave ivermectin to the cat. Total resolution of the urinary infections. Another patient asked me if I can help her friend's dog. He had seizures. She wrote the name of the dog, was Winchester. First I tested her, nothing showed up. She put the paper in her pocket. I tested the dog's brain. I said, the dog has mercury in its brain. We put the dog on metal cord. 6 weeks later, no more seizures. It's called quantum entanglement. Energetically, everybody on this planet is connected. And, it may sound a little flaky to you, but it's scientific. It's based on quantum energy. So anyway, let's see. My Aunt Mary wants to know how to balance the adrenals. She recently weaned off beta blockers. Wow, what a poison that is. Doctor put her on after she had aortic aneurysm removed. First of all, the aneurysm was coming from a nutritional deficiencies of good quality protein and bioflavonoids like Cyruta Plus from Standard Process. Yeah, no energy, no kidding, because when you suppress the pump, okay, then the blood supply to the tissues gets diminished and the toxic waste start to build up in all the organs. So, it's ridiculous. Magnesium works as a beta blocker because it quiets down the sympathetic part of your nervous system. The doctors just don't know this. So, they're just throwing drugs at you to suppress the function. And if you don't give the food-based vitamin C, especially the Cyruta Plus, and good collagen, okay, guess what? He's going to get an aneurysm somewhere else. So that's the problem with this nonsense, is that they're just, painting over the rust and hoping, that's my cat in the way here. Okay, Nikki, you have to lay down. Thank you. So the bottom line is you really have to start defining the underlying issues. If you don't address the issues, you're like trying to push a rope up a hill. It just does not work, people. Let's see. If you don't have any other questions, here, my question. What do you recommend for breast cancer? I have already worked with a super expensive integrative doctor who put me on 3,000. Wow. That's nuts. I know I need a multiple pronged approach. Okay. The key here is that you just don't throw vitamins at people. You have to define what's in the breast cancer. Okay. I just had a woman in today from Long Island. She had cancer on her nose, and same history, running around to all these expensive doctors. They're throwing all kinds of supplements at her. Nothing's happening. Well, when I tested the cancer on her nose, she had 6 heavy metals, lead, aluminum, cadmium, and the interesting thing, also nickel and mercury. She was wearing silver earrings, and I know right away. I said, okay, take your earrings off, and I tested them. And if you have silver earrings, the nickel was being absorbed into her body. That was one, which is carcinogenic. That was one of the 6 heavy metals. So if you don't define what the heck's in a cancer tissue, you're just throwing darts. You could do that very easily, either from the pathology slide, or if the patient is present physically, you can direct test over the cancer's area. Glyphosate was also in her cancer, and I believe cytomegalovirus. So, I was the first person that ever told her what the heck was in the cancer initiating it. She's read my book. She said they were incredible, very self-explanatory. It made more sense than anything that she's ever come across on cancer. And that's the way you have to approach it. You then have to clean out the intestines, the liver, the kidney, the lymphatics, okay, the lungs, and you have to work from the ground up, because in 1860, Anton Basham gave you the secret. It's the terrain. If the terrain is toxic, you're going to get cancer. If you don't clean up the terrain, you could cut it out, irradiate it, and chemicalize it. You're only setting the stage for more and more problems. So, Jennifer, how are you testing the lady with the nose cancer? With my hands. It's simple. We use a very sophisticated form of kinesiology. Okay, I call it quantum testing. I literally have vials of different substances, and I basically hold the vial over the area of the cancer, and if the strong arm goes weak, then it's called direct resonance testing. So I know exactly what's in the cancer tissue. It's non-invasive. It's more accurate than any of the fancy blood tests that they have, because a blood test is only giving you a snippet, okay, of what's floating in the blood at that particular time. But if it's trapped in an organ, or your breast or prostate or wherever, it's not going to show up in the blood. So that's why I say one of my big complaints about traditional medicine, their technology is obsolete. And unfortunately, people buy into the lie, and it's all perpetuated. It's supported by TV, radio, internet, the physicians, support groups. Goebbels said, if you tell a lie once, it's still a lie. But if you tell the same lie 1,000 times, it's the truth. So anyway, that's my story, and I'm sticking to it. How do you adjust the cranial bones so powerfully in 1 hour when it takes us 10 hours to get the same change? Because they don't know what they're doing. It's as simple as that. Over a 35-year period, I've developed a sequence that I use to release the cranium sequentially, and you have to follow the pattern. So, for example, right here is your, I call it the malar bone. It's a triangular shaped bone. And if you do a dried skull dissection, the first bone that must be taken out of the dried skull is this malar bone. So when I do my intraoral releases, that's the first bone that I release. So when you do that, it frees up the rest of the cranium. These osteopaths don't know that. So, they're trying to push a rope up a hill. They're forcing things. Whereas I free up the whole mechanism and then do the sequence that I go through, and we get phenomenal results. Good morning. Kindly suggest minerals or nutritional support pre and post removal of dental amalgam. Basically, or PMFs. The important thing is you have to clean the liver out. So you have glutathione, very, very powerful, curcumin, and make sure you have a good oil with it because it makes it absorb much more effectively. Curcumin, SOD, superoxide dismutase, the B vitamins, they help also the liver break up toxins. What else? Vitamin C is good. Selenium is good. I take wheat germ oil, so it has selenium in it. And you do that for at least a couple weeks. Make sure you're taking, when you get the amalgams out, you want to take the good clay. We use Clay FX from Premier Research that absorbs any toxins in your intestines, preventing it from getting absorbed into your liver. The trace minerals, I like the Gift from Mother Earth Labs down in Texas. Has 74 macro minerals, plus it has fulvic and humic acid. The humic acid chelates the glyphosate in your intestines, and the fulvic chelates it in your bloodstream. So you prepare the body beforehand, and then when you get the work done right after they finish it, you can rinse your mouth out with some chlorella. Okay, so it'll chelate any residual mercury that may be left. But when they're taking it out, they should have high speed evacuation and negative ion flowing over your body to help remove the any ions of mercury in the air. So the key is you can also take some good chelating agents. Like I said, resveratrol is very good, and that works. So fascinating knowledge you have amassed. Nikki is a beautiful cat too. Wondering your take on stem cells and something like repigmentation of vitiligo. Well, had a case of vitiligo from out in San Francisco. He came in. He had a DDT and some and glyphosate in the areas of vitiligo. So again, you have to detox the area of the vitiligo to remove the, I call it the splinter, that's preventing the pigmentation from being, deposited in that area. But again, you have to define it. And there's very few people out there that understand this concept. They're just throwing darts at people. So that's the way I would approach it. Stem cells, pulse magnetic therapy will stimulate stem cells. Scalar energy from the Therify will help stimulate stem cells. Some people, spend $5,000 and get stem cells injected. That's great if you have a nice big fat bank account. God bless you. But I try to do things conservatively. Our own body has plenty of stem cells. All you got to do is wake them up. And the pulse magnetic therapy machine has a big capacitor, and you put a coil around the area, and the capacitor keeps pulsing the electrical shock, which has a magnetic field around it, and it stimulates stem cells. I mean, when you get injured, guess what? You're stimulating stem cells, right? In order to get repair. It's a no-brainer. So anyway, that's how I would approach it. How do you cure tenderness and the hissing? Well, I've had a couple of successful cases. One in particular, she had overclosed jaw posture. And when I built up the lower back teeth with a partial denture, her tenderness totally reversed. Another patient had tenderness because he went to a rock concert, and when he left, his ears were still ringing. And anyway, when I tested him, I put him on zinc because the nerves in the ear have the highest concentration of zinc of any nerves in the body, and magnesium. And the two combined, it took 9 months to quiet it down. But that worked really well. You can also have a sympathetic dominant issue, which is caused by atherosclerosis or buildup of plaque. So again, you have to differentiate where the problem's coming from. The Dr. Brian S. Peskin's oil, the 11-to-1 ratio of omega-6 to omega-3 organic cold press, the best on the planet. That'll help dissolve out the plaque in the blood vessels. Also, zymescence is a great systemic enzyme. And the other interesting thing, a low-functioning thyroid, hypothyroid, which is not always going to show up in a blood test. That's a big false narrative that the blood tests are accurate. You do your armpit temperature first thing in the morning before you get out of bed for 10 days. If you have your menstrual cycle, start on the third day of your menstrual cycle. Do it for 30 days. If it's consistently below 97.8, guess what, people? You got a low thyroid function. That can cause tenderness. If you're on any medications, especially aspirin, that can cause tenderness. And there's a few other drugs, I'd have to look them up, that have a side effect of causing tenderness. So again, you always have to define what the underlying issues are. Anyway, is the pure synergy you prefer to the superfood one? Yeah, it is a superfood. It's organic and wild crafted. It has over 60 different grasses, herbs, vitamins, you name it. And it's unbelievably well documented. The fella, I think, is Mitchell May from Moab, Utah, who developed it in 1972. He was in a head-on collision in Nashville, Tennessee. 42 broken bones in his legs. They wanted to amputate. He said, no way. He had himself medevac to LA, where I think his parents lived. He was in the hospital for a year. He had a 4-inch piece of bone that was missing from his foot. Nerves were damaged, ligaments, muscles, you name it, and 42 broken bones. So he worked with natural healers. They came up with this formula, and it's probably one of the best documented cases in medical history. The 4-inch piece of bone grew in, the nerves repaired, the ligaments repaired, the muscles repaired. He has his legs. And all I can tell you is that if you feed the body Sunoco racing fuel, real nutrients, it's miraculous. It'll heal. But, when you're giving synthetic, I love that cat, picture of the cat. That looks like my Nikki. That's Amy. What do you recommend for boron? Well, bottom line is it's a mineral. Amy, I'm going to have to look that one up. I know boron is very effective for pulling aluminum out of the brain and other parts of the body. Probably anything that chelates the heavy metals like metal cord, glutathione, IMD. Again, you have to test. Platinum Plus is a very good amino acid to pull heavy metals out. So that's what you got to do. So here, Amy, look at Nikki. Come here. Wow. Okay. Yeah. So the bottom line is, you got to, again, define what the heck's going on. North Coast Nutrition. Is it a healthy to fast on a regular? Absolutely. You can do a fast if you eat dinner and then you don't have your next meal until like 1 o'clock. All the people that live to 130, they would get up at 5:30 in the morning, go out in the fields, work, and their first meal would be like lunchtime. So you have that long fast. And if you do it on a regular basis, you're taking the stress away from your organs, especially your liver, gallbladder, pancreas. So it's very healthy to fast. Do you have a guide on ways to detox the intestines and colon? Yeah, I have that online course. It's an advanced course. It goes through, there's 6 phases of stages that I do for detox. You just can't throw darts, and all the supplements are listed there. It's very detailed. It gives you the sources, where to get the stuff. But quickly, in my beginning talk tonight, I spoke about food grade diatomaceous earth. Okay, tablespoon and 12 ounces of water first thing in the morning. It not only scrubs the walls of your intestine, gets all the mucus, plaque, and junk off, it absorbs the poison, and it kills parasites. So that's a great way to do it. And then over 50% of people have parasites in the United States. And so that's where the ivermectin or agromectin is very powerful. And the two together work great. And also the ivermectin is very effective against COVID. And also you want a good probiotic. Again, Bravo, you can buy it online. Great, pre-probiotic. It has a GMAF in it, glycoprotein macrophage activating factor, which is very effective against cancer. Prescripticist has 29 soil-based organisms that we use routinely in our practice. Has university studies. It's great for IBS. And then the one from Budapest, Cocoon Drops, is very effective. 60 different live organisms in there. I take that myself periodically. So there's 3 good pre and probiotics that are available to you. But the main thing is scrape the walls on your intestines and get the gunk out and, clean up the parasites. So in your opinion, is it dangerous to detox if you actually have Parkinson's because it could cross blood? The key is if you do it judiciously, it only took me 35 years to connect the dots. But the most important thing is giving the liver the right nutrients to break the chemicals down. It'll put it into the bile and get it out of the body very efficaciously. If you just start to pull heavy metals, pesticides, herbicides, insecticides, chemicals out without preparing the liver, because listen, people, I made all these mistakes. That's how I can tell you. There's no books on this stuff. And so the key is it's not going to be dangerous if you follow the proper sequence and protocol. The liver needs the SOD, superoxide dismutase, glutathione, the B vitamins, curcumin, and there's also a liver chi that we use. It's very, very powerful, herbal. And again, you have to test to see how long you have to take these nutrients to then go into the next stage, which is homeopath. There's 9 different homeopathics to open up the avenues of excretion. So that's the next thing you do. There's only 1 out of the 9 that'll test positive for the patient. Then you go after the heavy metals. See, then you go after the glyphosate. Then you go after the infections. And the last thing you do is go after the vaccinations. So we have very little Herxheimer reactions, very effective in all kinds of cancer, you name it. It makes no difference if you have severe rheumatoid arthritis or IBS or systemic lupus. Makes no difference. You got to prepare the body for the dumping. So recommendations for lime. Yeah, mix it with lemons. Lemons and limes are great. All kidding aside. Again, you have to take the burden off the liver, the lymph system, the kidneys, the intestines. The cleaner you make your intestines and the liver and the organs of detox, the stronger your immune system is going to be. So the thyroid is very crucial. Okay. And again, heavy metals, you got to get those out. And then for Lyme, there's homeopathic remedies for Lyme. There's frequencies from the Rife device for Lyme. Ozone works really good. If you do rectally, vaginally, or ear insufflation, that helps burn it up. Then you have to go look if there's cofactors involved, babesia, rickettsia. All these different cofactors have to be addressed also. And then the thyroid's very, very important. So again, you have to take a comprehensive look. You just don't start going after the Lyme. Again, the terrain. If you don't detox the terrain, it's going to be very difficult to get rid of the Lyme, especially, in about, you have to go after any eggs that may be present also. How do you heal bone fractures in the spine and kypho? Osteoporosis, again, hypothyroidism. Hypothyroidism causes osteoporosis. So if you don't address the thyroid, you're never going to get rid of the osteoporosis. As far as the bone, there's protomorphogens from the standard process called Vials. It provides the blueprint, okay, the genetic blueprint to repair the bone. Then you need the minerals, and that's why I like Mother Earth has 74 micro macro minerals. You have organic minerals from standard process, so they're the bricks. And then the mortar is vitamins A, C, and bioflavonoids. And then you need the diffuser, the oils. Peskin's oils will push the minerals into the tissue where they belong. You got the protomorphogen, supplies the matrix to rebuild the bone. So if you do, I like vitamin ACP from standard process. That's the mortar. The BIOS from standard process. That's the protomorphogen. It gives you the genetic blueprint so the body can repair the bone. You got to get the thyroid working. If you don't, it's the metabolism of every cell of your body. And you need the oils to push the minerals into the bone. Anyway, that's the way I look at things. Looking forward to becoming a patient. Okay, thank you. In the meantime, wondering how to go about treating something that traditionally uses antibiotics to treat, like chlamydia or other infections. Bottom line is, again, there's plenty of natural antibiotics. Oregano oil is very powerful antibiotic. Okay, the Immuno from Immunocorp is good. Colloidal silver, noni. But the key is you have to test to see which natural antibiotic is effective against your chlamydia or whatever pathogen you have. I mean, I had a patient from Dallas, Texas, probably about 8 years ago. He had MRSA, methicillin-resistant staph. I was the 31st doctor. And of all the things that I test him, oregano oil, 100% pure from the Mediterranean, tested very, very positive against his MRSA. In 6 weeks, all his lesions disappeared. So you have to define the appropriate nutrient to take care of the pathogen that you find. You just can't throw darts. There's plenty of choices for natural, antibiotics. Colostrum is another good one that works. Vitamin C is good for viruses, bacteria. Okay. Anyway, I took Cistus tincture a few years ago to address chronic Lyme. It caused my teeth to feel slimy, and nothing has helped. I suspect it disrupted your microbiome. Well, your mouth is connected to your anus, okay? Not being facetious. The key in the equation, you got to clean out the intestines. If you don't do that, you're talking about 60 to 80% of your whole immune system. So again, you got to clean the whole intestines. It's all connected. And yes, when you start to go after a pathogen without preparing the body, if your pH is too acidic, it lowers your oxygen level. It's stimulating your sympathetic nervous system, your adrenals. Your immune system is going to be weak. So that's how you have to approach these things. You just can't go like a bull in a china closet and start attacking, the Lyme, the chlamydia, the cancer, whatever. You got to prepare the body. Get my books. I mean, I wish I can give them all away for free, to be honest with you, but I got to pay all my overhead. But my books were written to educate the people to understand that it's the terrain that is the bottom line of the disease process. Most people are way too acidic. Most people have cell membranes that are corrupted by the adulterated oils, the canola oil, the vegetable oil, the soy oil, the cottonseed oil. It's all poison, people. I'm telling you, it is pure poison. When you go into the bush, these people that are eating, roots that they dig out of the ground, their microbiome consists of minimum 4,000 different microorganisms because they're getting them from the soil. In a quote civilized countries, you're great if you have 12 or 1,500 bacteria. So anyway, why do some people have cancer, reoccurrence, and all? Real simple, because they didn't remove the splinters. And invariably, mercury is one of the culprits that is in the tissue that's not being removed. If you can cut it out, big deal. You can irradiate it, big deal. You're not getting the splinters out of the tissue. And that's why the cancer comes back. We had a woman with lung cancer that cut the tip of her right lung off. 6 months later, she developed cancer in the left lung. And she literally said to the doctor, I'd rather die than go through that surgery again. And when I tested the pathology slide, she had mercury, cytomegalovirus, and a pesticide. And when I removed those 3 splinters, the cancer in the left lung disappeared in 6 months. So we see it all the time, people. It's too simple. I used to eat a lot of dirt. Does that help? Yeah, if it's clean dirt. The problem is I had a patient from Iowa that had dairy allergies. And when I tested her, she had pesticides in her stomach from the dirt that she ate. When I got rid of the pesticides, she had no more problems with dairy. So yeah, dirt is fine, but as long as it's clean. I don't know where you're going to find, maybe on the moon they have clean dirt. I don't know. Clean dirt. Well, diatomaceous earth. That's fantastic. Where do you purchase the 9 items you test to see what person needs a detox bath? Well, energetics, but I think you have to have a license to buy the homeopathics from Energetics. And the other one is Des Bio from out in Utah. They have 5 homeopathic drainage remedies, and Energetics has 4. But I don't think that they'll sell directly to the public, to be honest with you. So we're all done. Where do you get your vials? We basically make it up. My technician imprints, I don't think I have a little vial here. Anyway, she imprints these little Pyrex vials with frequencies. And, actually, I think we sell test kits. You'd have to check with Rebecca or Marissa at the office, the price of different kits. But I have like 4 kits with pesticides, herbicides, insecticides. We have 1 for all the heavy metals. I think we have 1 for vaccines. We have 2 for viruses, all the different viruses. So that's, you have to have the electronic devices to imprint the frequencies into the water, because water is a crystal and it holds, it has a memory. Water has a crystal and holds a memory. And so it'll last a lifetime. No big deal. Okay. Issues with due to steroid injections. How to lose 80 pounds. Tried everything. Well, take your armpit temperature first thing in the morning before you get out of bed and see where your thyroid is. So if it's consistently below 97.8 and it's low, then the metabolism's low in every cell and you're not going to shed the weight. So that's one major issue. Also, my other feeling is that you may need a fecal transplant. It may seem gross to you, but steroids destroy the healthy microbiome in your intestines. So they've actually taken fecal material from skinny people and put them into fat people, and the fat people literally shed the weight no matter what the heck they ate. So apparently there's a lot that has to do with the microbiome. So, you need a good quality microbiome. In fact, the one from Budapest, the cocoon drops, you have to take it probably for a good 6 to 9 months to rebuild your intestines, but you'll start to lose weight from those 60 different living organisms that you're reimplanting. My gut feeling is that your steroids destroyed your healthy microbiome, and that's why you can't lose weight. The other potential issue is the thyroid issue. Another one is, again, the organic cold-pressed oils, so that your cell membranes can repair. They literally turn to plastic from the adulterated oils, and the regular organic oils will help burn it up. So you have 3 issues there. Mercury, second deadliest, but absolutely second only to plutonium. And the reasons why it's so damn toxic is because it gives off between 13 and 21 different frequencies. So it totally disrupts the frequency inside the cell, really messes up your mitochondria, which are actually like the dispatchers of the cell. It gives the messages to the rest of the organelles what to do. That's why it's so darn toxic. Could you explain some of the favorite tests, like the CyberScan, the Rife machine? Well, the Rife machine's not a test. It's a treating device. You have to know what pathogens or chemicals that are present in order to set the frequencies of the Rife machine. You have found the direct resonance testing, the quantum testing that I do is very, very accurate. Do you trust tests like Biome from Microbiome RNA? I'm not familiar with that, to be honest with you. I don't have any experience. The CyberScan I've been using for probably 5 years now. I actually have 2 units in the office. Very powerful. It has a database of over 135,000 electromagnetic signatures. So it's very comprehensive. Help me understand what you mean by frequencies. Okay. Do you listen to music? That's frequencies. Do you have a key fob to lock your car? That's frequencies. Your key fob is a transmitter. It's giving off vibrations. So everything in the universe has a signature frequency at which it vibrates. So every virus, every bacteria, every chemical, even rocks, stones, precious, they all give off sound vibrations. And Rife, back in the 30s, had a microscope that he developed, and he was able to determine the frequency at which viruses and bacteria vibrated. And when he subjected them to the same frequency, they literally exploded. And he worked with Lee DeForest, who was the inventor of the vacuum tube, and they developed the Rife generator. And so he was able to cure cancer and many other diseases. And of course, they came down on him like a ton of bricks after they cured 130 days. They had 16 terminal cancer patients. When they cured them, that's when it all hit the fan. 11 research centers around the United States mysteriously burned down that were validating Rife's frequency technology. So you know darn well it's the pharmaceutical industry that did it. Anyway, is kombucha real beneficial? Absolutely. Fermented foods are very, very healthy, very healthy. And you could ferment, if you go on YouTube, you'll find all kinds of recipes, how to ferment vegetables and everything. So go for it. Anytime it's fermented, it's usually good. Unless you have a sensitivity, some people have severe migraine headache problems due to fermented foods. It's the tyramine in the fermented foods that can trigger off the severe migraine. So, you have to be careful from that perspective. Rife notes were destroyed. Who continued his research? I don't know who continued his research, but I do know Nina Silver. She is a wonderful human being, PhD, smart lady. She wrote a Bible called the Rife book, and it's real. It has pretty much every known right frequency. There were 5 universal microscopes, and the establishment, the pharmaceutical cartel, they confiscated, I think, all but one, and so somebody has it. Don't know where, and I don't blame them for not divulging it. And I guess they're the ones that are doing the research to determine additional frequencies. And then I think every year in Vancouver, there was a big international Rife conference, and people from all over the world would go there and meet and share their frequency stories with each other, that, what they found clinically worked really well. So I think there's a lot of trial and error that's being done, but there's plenty of known frequencies out there to cover pretty much all bases. So Pamela, thanks for the question. Do you have any experience with high doses vitamin C, mistletoe? No, I'm not into high doses. The human body works off of food, which is low dose, and it's more biologically active. Pine needles is loaded with vitamin C, and I just started to drink pine needle tea, which helps to counteract the spike protein from people who, let's say, are around individuals that got shot up with the inoculation, the COVID inoculation, and it helps counteract that. But yeah, I'm not a big fan of high doses of vitamins. Most of them are synthetic, and to me, but if it's from a natural source like mistletoe, yeah, go for it. The PMF, yeah, the Beamer is a frequency machine. And again, if it's treating inflammation. So the bottom line is you're treating the wagging tail of the dog. What's causing the inflammation? Is it glyphosate? Is it mercury? Is it DDT? I mean, I had a guy who had cardiac sarcoidosis, chronic inflammation of the heart, and the Mayo Clinic says there's no cure, and they wanted to put him on steroids. He said, thanks, but no thanks. I found DDT in his heart from childhood. He was exposed to those trucks spraying it in India, and he and his buddies would chase the truck. He had DDT in his heart, glyphosate in his heart, some heavy metals. And once I got rid of the splinters or the core, guess what? His cardiac sarcoidosis disappeared. And that was in 5 months. So you have to define it. So again, the Beamer, great instruments, but it's not getting to the core issue of causing the inflammation. People run around, they get the A1C test, oh, my A1C is high, they put her on drugs, and it's nonsense. You have to get the core issue causing it. Infrared saunas are great for cancer, for detoxing, but again, all cancer is not a disease, people. It's an adaptation to hypoxia, low oxygen, and toxicity. So infrared saunas are good as adjunctive therapy, but what's in the tissue causing the cancer? If you don't define it, you're not going to get a home run. Do you recommend any of these? When it comes to frequencies, I want to define what the causative factor is. I don't want to play games with just treating the inflammation. So that's my feeling on it. Do you think having any amalgams? Oh, can you Jared, pop that back up? Amalgams are toxic. There's no two ways about it. They give off mercury 24/7. It's really bad. Let me see. Do you think having my amalgams removed? Well, let me tell you something. You got to find a dentist that knows what they are doing. There's special ways to remove it. And if you go to Switzerland, they do one a year because it's so damn toxic. You have to be on supplements at least several weeks before to build up the body. You have to have a special high suction devices to suck out the vapors. You have to have special devices to fit around the tooth so that the vapors and the debris get sucked away real quickly. But yeah, the mercury from the amalgams can definitely cause cancer. And again, define what's in the cancer. If you define what's in the cancer and remove it, it'll disappear and highly oxygenate the body. Had a biological dentist. do it, but I wonder. I've also been told antibiotics. Well, antibiotics are toxic. They suppress the infection deeper into the tissue. It also destroys the healthy microbiome in your intestines. If you take 1 week of antibiotics, it can take a year. It'll destroy the natural bacteria in your intestines for a year. That's how bad they are. So you really have to build the intestines and your immune system from ground up. High dose of it for 2 years for Lyme. If you don't reestablish, clean out your intestines, the diatomaceous earth, the anti-parasitic cleanse with the ivermectin, the good quality, and it could take maybe 9 months to rebuild your intestines with the probiotic. That's nasty stuff. It's really horrible. So could you explain how to take advantage of scalar energy that you speak of? Nikola Tesla was probably one of the brightest guys in the history of civilization, or at least our civilization anyway. Scalar energy has 3 basic components to it. One, it stimulates stem cells for repair. Secondly, it neutralizes chemicals and viruses and bacteria because it changes the frequency of the toxin. And thirdly, it helps to repair the DNA by cleansing the DNA. So scalar energy is very, very powerful. Let's see. If you have mercury poisoning and still have dental fillings, should you detox or remove? You got to detox first, because if you are toxic with mercury and you go and get more fillings out, you're going to get a hit. You'll go down the toilet. I'll never forget, I had a patient years ago. He was a physical therapist. He went to a biological dentist, and they were doing quadrant dentistry. It was cutting out the mercury fillings in one quadrant of his mouth. He was in bed for 4 months. He thought he was going to die. You don't go that route. You better detox, maybe a good 6 months. If you got a lot of mercury fillings, you got to detox for a good 6 months, and then start removing them slowly. Because you could really get burned. And then the other problem is they have to test the biocompatibility of the resins that they're putting in your teeth. You just don't go put anything to fill your teeth. And then also, if the bite is not correct, it'll distort your cranium. Now you're going to open up Pandora's box. 99.99% of dentists have no clue about the bite and the cranial mechanism. So you can go from the smoke and into the fire and flames by just having your mercury fillings out, and they screw up your cranium and your spine and your pelvis. I've seen it too many times. So Linus Pauling protocol, do you support that? He was into high doses of vitamin C. I do not buy into it. I'm sorry. Ascorbic acid is not vitamin C. It works as an antihistamine in large doses. So I'm sorry. The body needs all the components of vitamin C: hesperidin, rutin, tyrosinase, organic form of copper, bioflavonoids. That's what makes up vitamin C, not ascorbic acid. Ascorbic acid is like saran wrap. It'll keep the sandwich fresh. It's a good antioxidant, antihistamine, but you can't heal with just ascorbic acid. The pine needle tea is very high, very high. Okay, I've been told we did the Parkinson's. I answered that question. You got to detox the colon, the parasites, ivermectin, food grade diatomaceous earth. Yes, Parkinson's, and then there's toxins in the brain. So again, you have to do direct resonance testing, remove those poisons in the brain to get it functioning. It'll work. Do you place any trust in functional genomics testing? I don't buy into that. I'm sorry. That whole thing was basically a scam for the drug industry. Epigenetics is the most important thing. It's the environment that dictates the physiology of the cell. Bruce Lipton proved that. And also, back in 1860, Anton Priori Anton DeCamp, anyway, I feel like Biden already. But he discovered that the terrain, when it got toxic, the healthy bacteria would transmutate into pathogenic forms. That's the way it works. It's been proven many times over. Dr. Greger says only 200 milligrams of vitamin C can be absorbed at any one time. Well, Diana, all I can tell you is that my good friend over in Budapest, Dr. Robert Lyons, has hardcore scientific documentation that when you increase the oxygenation of the human body produces its own vitamin C. He has science behind it. That's not maybe if. So, the key is food grade vitamin C, not ascorbic acid. So that's the way I would go. And the body, in its infinite wisdom, will absorb whatever it needs to absorb. But again, if you have a leaky gut problem because of glyphosate in your intestines or parasites in your intestines, you got problems. So again, you got to rebuild from the bottom up. Mama has a horrific pain in her ankle. She was treated with steroids, which is crazy, but because they thought it was gout. Uric acid is normal range. She now has been diagnosed with lupus. Okay, so it depends. Again, I had a patient with lupus, and when she was pregnant, she was put on a drug called Bendictin. It was trapped in her liver. Nobody ever picked it up. The drug was discontinued in 1986. My good friend up in Canada got me a sample from a compounding pharmacist, made it into a homeopathic. When I removed the Bendictin from her liver, 9 months later, her lupus disappeared. So again, you have to define the splinter, and more than likely it's probably in her liver that's causing the connective tissue problem. You just don't go treating symptoms, haphazardly. So what do you use to detox the liver? Again, glutathione, SOD, curcumin, liver chi, which is, we went over that, I think, a few sessions ago. If you go to ghsdoc.live, all the old videos are archived there, and you can see about the detox. It's all on there. But, when you can go get SCACT, you can buy it online. There's a company called Star West Botanicals out in California. Great products. You buy their SCACT. Detox your colon, your liver with that. It works really well. Easy peasy. Just take 2 ounces of the concentrate mixed with 2 ounces of water. You take it before bedtime. So anyway, I think we've answered pretty much everyone's questions. I really enjoyed that. Next week, we'll go over some, like 25 plus nutritional pearls to help, give you quality of life, outrageous quality of life, and longevity. Just say no to doctors and say no to drugs. One of the leading causes of death is lead poisoning, but the other leading cause is 800,000 people a year are killed by doctors and hospitals. There's a great article written by Gary Null called Death by Medicine. The establishment doesn't like it because he's telling the truth. He took the government's own statistics and proved it. About 800,000 people a year are killed by the hospitals and doctors. So, and, if you want to also remember the great quote by Mark Twain, he said, "Be careful about reading health books. You may die of a misprint." So I love his sarcasm. There's a lot of truth to it. It is what it is. Anyway, I had fun, people. I hope you got a lot of good information. This video will be up on ghsdoc.live. You can review it, share it with your friends. The key in the equation is what's causing the problem. Stop chasing the wagging tail of the dog. Stop chasing the symptoms, the inflammation, the rashes, the this, the that, the flu symptoms. It's the underlying causes. Anyway, God bless you. Stay well. We'll see you next week, and enjoy life and hug a tree at least once a day. Thank you.